Hi, I'm Dr. Erik Dutson at UCLA, Ronald Reagan Medical Center. I work currently as a surgical director for UCLA Center for Obesity and Metabolic Health. So there have been some class action lawsuits, as we discussed last time, related to Da Vinci's specifically faulty equipment that resulted in some bad patient outcomes and injuries. And there have been allegations that the company was pushing clinicians into use of the device prior to proper training. The company itself has been responsive to this, and they have fixed the arcing problem that resulted in adjacent tissue damage, and they have made it known to all users of the system that this problem was in existence and to use caution if they should have any leftover disposable stock on their shelves. And they have also backed off, I think, on some of their more aggressive tactics towards pushing clinicians who are essentially unprepared into the operating room with technology that they're not as familiar with as they should be. So I think there are some new developments with the robotic system that and developments that took place because of the robotic system that are spinning out into more general applications, and that has to do with widened spectral visual imaging. And let me give you an example of that. The Intuitive system has a device called the Firefly system, which I think we talked about briefly last time. But now there are other companies who are deploying this advanced spectral imaging to other standard laparoscopic cases. So this is kind of exciting because we're getting ready to initiate a clinical trial here at UCLA where we will be able to make a patient's biliary tract and gallbladder glow under alternate spectral conditions. And the reason that's important is because a laparoscopic cholecystectomy is the most frequently done general surgical procedure in the country. There are about 500,000 of them done every year. And one of the big concerns with that operation is injury to the biliary tree or the common bile duct. If we're able to make those structures become bioluminescent while we're working, that would greatly reduce the likelihood of inadvertent injuries to the structures that should not be dissected. So this is a bit exciting and something we're starting to work on here at UCLA that I'm enthusiastic about.